One of the most frequent questions we get here at the school is whether or not students can use their cups to reduce the appearance of cellulite. If you look on Amazon, you'll see many advertisements that will show that the cups are for treatment of cellulite conditions. Treating cellulite is a fairly lucrative practice, and that's because there are not very many things you can do to improve the appearance of it. Some people think it has to do with fitness or with somebody who has a bad diet or nutrition and stuff like that, and that couldn't be further from the truth. Cellulite is a genetic condition. When I was 19 years old, competing in the Athens Olympic Stadium, ripped at 110 pounds and no more than 10% body fat, I was covered in cellulite as a teenager. I was 19 years old. And I had to do a lot of cardiovascular activity because I'm 5'4", and I'm not naturally 50 kilograms or 110 pounds. And I still had cellulite all over my legs, despite being very fit as a teenager. Okay, so cellulite is an unsightly condition, especially those who are super fit and work very hard on their physical appearance, and they have something that doesn't look so great on their legs. And believe it or not, there is a vacuum therapy that treats cellulite that can improve the appearance of cellulite. And that's known as LPG, which stands for Louis Paul Guiteau, the inventor of endermology. Now, they've gone through some rebranding changes over the decades, but the endermology that we're going to tell you about is the original practice that was approved by the FDA to be advertised as a temporary improvement of the appearance of cellulite. Now, Louis Paul Guiteau's story about how he invented the endermology machine is fairly interesting. Louis Paul Guiteau had a bad back and he had surgery on it. And he was going to physiotherapy, and the way the story is told is that they were practicing skin rolling, myofascial skin rolling over his surgical scar to help relieve scar tissue and adhesions, hence reduce pain. And apparently, if he had a particular therapist early in the morning, he would have an effective treatment. And that would result in a reduction of pain. But if he saw that same therapist later on in the day and the therapist was tired, then the treatment wouldn't be as effective. And apparently that therapist didn't work every morning. So he booked other therapists in the morning to try and get a fresh therapist, a fresh set of hands. And he found that some of the other therapists weren't equitable to his first therapist. So he wasn't receiving consistent therapy, and that resulted in whether or not he had a day of pain relief or he had a day with pain that wasn't relieved at all. So what he did is he thought he would go out and invent a machine that could practice similarly to the myofascial skin rolling. And that's exactly what he did. He created the endermology machine. Louis Paul Guiteau's endermology machine is probably similar to an industrial vacuum. It vacuums up the skin into this treatment head with rollers, and it rolls the skin to help break down adhesions that happen in the body, specifically with surgical scars. Now, he sold this machine to several physiotherapy clinics who were using it to treat other surgical scars, including knee surgeries. And as the story is told, the physiotherapists were doing endermology around the knees to try and break down scar tissue, increase circulation, increase pliability, hopefully increase range of motion. And what happened specifically with the female clients is around the knees, if they had cellulite, there was a great improvement of the appearance of that cellulite. So they had this smooth patch of skin, and then they had rimply cellulite. So they were asking the physiotherapist to do the entire leg. So there wasn't just a big circular patch of smooth skin with wrinkly skin all around it. So the physiotherapist would do the whole leg. And then they had one leg that was smooth skin and another leg that was wrinkly orange peel cottage cheese in appearance. And so they wanted to keep on coming for endermology. They wanted both legs treated for cosmetic purposes in these physiotherapy clinics, and the clinics had enough. They called Louis Paul Guiteau and they asked him to consider opening a cosmetic clinic for endermology to treat cellulite with all these people who were coming back trying to get their cellulite treated. And that was how endermology was born, to practice improving the appearance of cellulite with this vacuum therapy. Endermology works by suctioning the skin up into the rollers. And if you look at the red fiber that's attached to the skin, that's connective tissue, collagen tissues, protein, anchoring fibers. And what they're doing is, as we age, the collagen fibers can become short. And then we have all our fat cells in the skin, the subcutaneous fat, right? So what happens is the endermology machine suctions up the skin and rolls it, and it stretches those connective tissues. It elongates them, their elastin fibers, and it also rolls out the cellulite, the fat cells, so they're more evenly distributed. And when you have those anchoring fibers that are pulling down the skin, once they're stretched and no longer pulling down the skin as much, and the fat cells are more evenly distributed within the skin, you no longer have that cottage cheese orange peel appearance on your legs. I'm recording this in 2023, and I just did a search in the National Library of Medicine on PubMed.gov for cupping research citations and papers and studies. And I found over 2,000 results just for cupping. But if you look for research for cupping for cellulite, there are no results, none. Okay, I've never seen anything that produces no results. Usually something has been researched. And cupping for cellulite probably has been researched, but maybe they didn't publish because it probably wasn't very effective. I did another search for cupping and pain, and that produced over 300 results. So there are plenty of cupping studies, but none for cupping for cellulite. And that is probably because we don't have any research that shows that cupping is effective to treat cellulite. If you search for endermology in the National Library of Medicine in the same exact place, you will find that endermology has been published as a treatment for cellulite. In fact, endermology was the first FDA-approved method to use a machine to improve the appearance of cellulite. So this is our LPG machine right here. It's called the ES1, and it was the first endermology machine that was created by Louis Paul Guiteau. With the endermology machine, it's like a commercial vacuum, and it suctions the skin, and then you have these two rollers on both sides, and the rollers literally squeeze the skin together. You can see that they close, and they start rolling the skin as the vacuum cleaner, as the suction or vacuum therapy suctions up the skin. The skin is then rolled. You can control the amount of suction that you put on the client with this plus and minus sign here. Okay, and this can show you how much suction is being achieved. Sometimes these are really very, very red. If you want extra suction, there's a red 10 over here with a red hammer, and you can really, practically tear skin off from somebody with this industrial vacuum roller. So the machine has a hose on it, which is required because that's where the suction, the vacuum, is coming from. And this is a Cellulite 6 head, which was used on their second version of N6 machines. It's pretty cool. Now that's a fairly large treatment area where we typically worked on buttocks and thighs for cellulite improvement. But it's thought that vacuuming and suctioning skin can help boost collagen and elastin production. So what LPG did is they gave an accessory handout here, okay, or accessory tube or whatever you want to call it. And then they have these smaller accessory rollers, okay? So you would just put your accessory roller onto this accessory tube, and then you can do things like stimulating the face to stimulate collagen and elastin production. I don't know how well this is going to remove cellulite. I don't think it would be very effective, simply because these two rollers do not close. They're hard in place. The thing that makes this endermology machine effective, in my opinion, is the rolling. Because not only are you suctioning to pull on the collagen and elastin fibers in the skin, upwards and outwards like a reverse suction would create on the human body, but the rolling then further stretches those elastin and collagen fibers. And any type of adipose that's trapped up near the skin, in between those collagen thick fibers, the protein fibers, they're rolled flat. So if you think about cellulite in that orange peel or cottage cheese appearance that can be on our thighs, when this rolls it almost rolls the fat out, so it's kind of more even in texture, and it doesn't appear as rimply as without the rolling. There are other companies, after the FDA approved this as a temporary improvement in cellulite, that tried to mimic this. It was a copyrighted and trademarked technology. So there were other companies that tried to come out with similar machines that were not exact. They were just like basically vacuum cleaners for the skin without the rolling. And they weren't really as effective as this. Also, I do not believe they were ever cleared by the FDA to be able to claim that they temporarily improve the appearance of cellulite. But this was the first FDA approved method as far as a machine goes to improve the appearance of cellulite. That is a cosmetic concern. It's not considered a musculoskeletal or orthopedic concern. And it was effective. We used to sell sessions in about 12 packs. And if you purchased 12 sessions in advance, you actually only paid for 10, and we gave you 2 free. And we usually provided about 12 to 16, maybe 18 sessions the very first time a client came to see us. Once they got the maximum improvement we think we can achieve, which is usually achieved in about 12 to 18 sessions, we might not get every dimple smooth, but we get most of them. Some deeper dimples, they might not disappear altogether, but it'll be a smaller dimple on average. Once you get your initial improvement, then you would come like maybe twice a month for regular maintenance. So usually when we did this vacuum therapy with the rollers, with the endermology head, you would come 1 to 2 times a week for 12 to 16 weeks. If you're doing one session a week, it'd be 12 to 16 weeks for your initial treatments. If you were doing 2 sessions, you might get done in as little as 6 to 8 weeks. And then after that, that's when you'd go into maintenance. And think about it. If you went to the gym to work out and you intensely worked out and you got results, if you stopped working out, would those results last forever? No, of course not, because we continue to age and our body continues to evolve with time, right? That's the same with the endermology. We can improve the appearance of the cellulite with the suction, with the rolling, but we're going to continue to age. Our fat cells are going to continue to expand in new places. And if you're not continually suctioning them, rolling the fat, pulling on the collagen fibers, then that cellulite appearance will reappear again over time. So if you are keeping up with your maintenance, we can usually keep your improvements, if not build upon them. But if you stop your endermology, then you would have to maybe 6 months goes by and you're like, oh, wow, that really was working. Look at my legs now. If you came back in, you'd have to start that once to twice weekly for another 12 to 16 sessions before we go back into maintenance. And that is how endermology works.